Yeah, you're welcome.
Hi, I'm Courtney.
Hello.
Are you guys ready?
Not quite
No.
actually. We
Okay,
we were
well,
allotted.
I'll just turn the camera back off. Let me know when you're ready, okay?
Okay,
Thank
awesome.
you.
Will do. Thank you.
Sarah, I reshared it with you with the email you sent.
Okay, thank you.
I just left off saying I think we should split the obesity and diabetes into two different like problems for them.
Categories?
Yeah. Which do you guys think would come first, the diabetes or the obesity? Maybe the obesity because it's like the. Go ahead.
I wasn't sure. I was also on the same thing about the diabetes or obesity, which would trump the other. But I was thinking if you were to get the diabetes under control, maybe that would also in turn help the obesity. Like it might be a little easier to treat the diabetes than the obesity.
So
Yep.
the way I was thinking about it was kind of like if I treat the obesity, it's kind of going to like help her diabetes in a way. Like if we can switch her to a medication that can help the weight loss and reduce the A1C at the same time, that can help her uncontrolled diabetes. So I was thinking something like switching out the GPP4 sitagliptin that doesn't really help with weight loss. So I was thinking of switching it over to a GLP-1 agonist like Ozempic, semaglutide, or like something new on the market that I just learned about, Manjaro. It's really shown to help weight loss and reduce your A1C.
I like it.
So would we want to put, again, just to clarify, so you're saying you want obesity the first issue, like the top issue, and like a semaglutide or a GLP-1 as the recommendation for that?
Yes.
Okay. So the concern would be
I didn't really think about insulin because I know that can like affect her weight gain. So I was thinking we could just stick to a GLP-1 for now.
Okay. So do you want to take her off the sitagliptin, and add the GLP?
Yes.
And then what about the metformin? Do you want to keep her on that, or should we?
Yeah, I think we can keep her on that because if you're doing two together, it won't cause any. They both have low risk of hypoglycemia, so I think it's okay.
Okay. So number two, again, this is just anyone feel free to disagree. I would say it's probably between the diabetes and the hypertension. But that was just my 2 cents. What does everyone else think for number two?
I agree with the diabetes, but I also think a concern for her is that she has pain. So I know like maybe like a toothache is like not a big deal or something, but a lot of times we'll treat someone emergency right away because they have pain. Like that's like the whole reason that they're coming in. So we don't want to make them leave with still pain. So I understand like hypertension is like a silent killer and all, but when we treat the diabetes, we can furthermore like help her periodontitis issue and tooth pain.
Okay, so we want to put the active tooth pain at number two, because I think there were actually 2 instances. She had like the periodontitis and then she fell.
Yeah, I was thinking maybe 3 because we mentioned obesity, diabetes. I was thinking maybe 3rd because she does have lower left jaw pain and it just kept getting worse ever since her fall. So we could check like TMJ discrepancies and things like that if she grinds her teeth at night.
Okay, so check for TMJ disorder. What else would be a recommendation, or do we just need one, I guess? Okay. I mean, yeah, check for TMJ disorder or like established care with dentist or something.
Yeah,
and on her files though, it says that Courtney struggles with
finding a good dental clinic due to insurance and cost restraints.
Yeah.
So that's something I'm going to go over with them.
Okay.
Also, part of the reason a contributing factor to the obesity is that they're food insecure and that they don't have access and cannot afford healthy food or healthier food. So that's something I'm going to go over, along with depression and also worried about cost of joining a gym.
Okay. Are you social work? Just
Yeah.
Okay.
And so
So
when we did the orientation, she kind of showed, like, the person who ran it is like, I'm going to start it all off. Like, I'm going to introduce us all first. And then my idea is like, I'm just going to go down on a line with all of you and be like, for the pharmacist going to talk to you dental. And then in between each one, I'm going to check in with the patient each time to see if they understand it and if it's attainable. Does that make sense? That's why it's like they have an order, so I can tell Courtney, like, okay, well, Dr. Lindahl and Dr. Morris are going to talk to you about this. And then, does that make sense?
Yeah.
Or are you guys okay with that, or you think we should do something different?
No, that sounds good to me.
works for me.
Okay.
For the recommendation for the diabetes, it's kind of the same thing, the GLP-1 agonist. So is there any other recommendation or intervention that anyone had for diabetes that is distinct from that, or do you think it would kind of tackle both, that recommendation? I guess we could put it there either way.
I think they kind of overlap, but
So for obesity, I'm not gonna put the stop sitagliptin. I'm just gonna put the GLP-1 agonist. And same thing for the metformin, just so it looks like they're not the same thing. Okay, number 4. So are we comfortable putting like maybe hypertension at number 4? Or does anyone else have a different problem? I'm not like married to hypertension. We don't need to put that in there.
No, I think that'd be a good spot to put it because it's definitely high. And she has like some spikes as well, but I feel like where we have it listed would be okay at 4.
Also, I think I remember she said she's like misses doses of her blood pressure meds, and that's like a huge risk factor for ACS, acute coronary syndrome. So probably needs counseling on that. I also think she is on, let me bring her up. She's on 5, amlodipine 5 and benazepril 20. That also comes in like 10/20 and 10/40. So I think we should just increase to like 10/20 or 10/40 the next few months.
Yeah, I'm not too familiar with dosing, but I was thinking that we should increase the ACE inhibitor just because it looked like her GFR and renal levels were getting kind of close.
Okay. All right, awesome. I'll do increased dosage of. Okay. Yep, I think that 5th one is a great point. Her like depressive symptoms and anhedonia. What do we think about for or if everyone else agrees, what do we think about for recommendations on that one?
For number 5?
Yep.
I will just connect Courtney with another therapist, if not myself.
Okay.
I also read that her husband is also hypertensive and obese as well, and he's very stressed out. And she's depressed. So I was also thinking like maybe if you could get them in like a couple workout, or if they could get like a Planet Fitness cheap gym membership and like be able to start reading again together while working out. Or
yeah, that was going to be one of my things is like, do you have any do you think anyone at home can motivate you to help you like like a partnership? But I I wouldn't establish couples counseling or anything like that until like a couple sessions with Courtney alone to see
Cool.
if that's that.
Oops. Sorry, I didn't update for a second. Who's ever updating that recommendation box? I didn't see that you were there.
Oh, sorry. I just added like to just counsel her on her adherence issues
Okay.
with
Yep.
the blood pressure. I don't know if you guys think it's appropriate to talk about like limiting salt intake and stuff for her hypertension, like a DASH diet. I know I know in the case it said she's trying, but it's been a little hard for her, so
I like that idea. Give her some knowledge. Can never hurt.
We don't have physical therapy, so for the ADLs and IADLs, it seems like that's a problem. But I don't know if you guys want to address that today, or if we just want to, refer, like, say that we would refer them and just do like a brief check. I don't know. How do you guys want to attack that?
I can talk to Courtney about why they think they are having trouble with losing weight, to see if there's some kind of mental block there and go over that. And then also when we were talking about symptoms of depression, Sarah, you can also kind of chime in on that, like in the thing as once I'm talking about that, I'm going to bring up if Courtney feels comfortable going on any mental health meds in the future, not right now. I'm not going to suggest that they go on anything before you have like an intake, but like talk about that as a potential possibility and see if they've ever been on any before that's
that
just
sounds
not
good.
listed.
That sounds good.
Okay, so we can kind of start filling in the roles and responsibilities thing. I think we identified our biggest concerns and recommendations for those. Social work, I typed something for you. Feel free to, just when you were talking, I just didn't want to forget what you were saying.
Okay, yeah, I saw, thank you.
I can do obesity, Sam, if you want to do hypertension, I guess, because didn't our pharmacy students say they were taking diabetes,
a good
maybe the
idea.
diabetes counseling?
So I'll take diabetes.
Okay. Is that okay with you?
Yeah, of course.
Awesome.
So obesity and diabetes are kind of like similar. So how do you want to do this?
Yeah, I will. Let me look through the patient case a little bit. Like I can talk to her about healthier eating and like exercise routine, and then if you want to do like
The medication.
like introing her to the new drug.
Medication. Okay.
And should I talk about the missed doses as well when I talk to her about her hypertension?
Probably, yeah.
I can definitely talk to her about her periodontitis and tooth pain and options she can look into for that. Also, the file that was shared, I don't know why it still won't let me open it, even with my Wayne email. Is there like another way to share it, or?
I'm gonna try to download it and put it in the chat.
Hold on, I'm gonna put a link to it in the chat.
Okay. And also, I can kind of touch base on like her osteoarthritis because it's affecting her left knee. So like it would affect her knee first, but if she's having jaw pain, then maybe it's affecting her TMJ as well.
Yeah, so I think for obesity, I'm just going to talk to her about dietary changes that she's already kind of trying to make. And then I'm just going to do like PT kind of and just like recommend stretching at home, and we can find like resources to send her after in the patient care plan.
And then just make sure when you're talking about the diet and healthy eating, like talk about, I know that's, you've mentioned that you have like some food insecurity, and then just kind of try and like at the end, like refer it, kind of like come back to me, and then I'll address the resources for that.
Okay.
So are we ready, or you want to wait?
I could use a couple of minutes just to kind of look through it real quick, but then I'm probably ready.
Yeah, sorry.
Yeah.
Just a couple minutes for me too.
Yeah, it still won't work. I literally don't know why. It says I can sign in, but I don't have access to it. Should I just like send you guys like my portion of it and someone can just copy paste it?
Yeah.
Okay.
Can you open the patient care plan?
I have
As
the
I said-
patient plan, but when I click on the link, I can sign in, but it just says I don't have permission to look at it.
So just to be clear, Irene, you're going to intro the patient in the whole encounter, right?
Yeah.
Okay.
And
And
can
then
everyone just go over their last names real quick so I pronounce them correctly when introducing you?
mine is Lundahl.
Wendell, okay.
Samuel Morris.
Okay.
Mine is Abadrabo. If it's too hard to
Abadrabo?
pronounce, you could just say like Sarah, or it doesn't matter.
Okay.
Or just my initial of my last name. It doesn't matter.
Okay.
Mine's just Oro.
All right. Okay. Do you want me to refer to all of you guys as doctor? Or
No,
what?
Okay.
not needed.
Okay.
I'm not a doctor yet.
Okay. No, it's fine.
Student.
I just wanted to double check.
Thank you.
I'm still gonna refer to you guys as, just be like the doctor, like the med just so they know like what specificity, whatever.
And then do we plan on going in the order of the disciplines, like social work first and then me last?
I was gonna go by the thing where it's
The concern?
the concern, yeah.
I like that.
But I'm gonna introduce myself first because that was one of my roles, and then like I'm just gonna introduce each guys like by discipline, and then like once you guys are done talking, I'm gonna like just double check with Courtney that they understand it, like that if they still have any questions about that, and if they think it's attainable.
Okay, we have like 30, 34 minutes.
I'm sorry, were you talking to us?
Yes.
Oh,
I leave the site at 2:45.
yep.
Okay.
Do we want to get started at 2:15? I think they allowed us 30 minutes for the appointment.
Yeah.
But it also probably shouldn't take all 30 minutes, just so you know.
Okay.
All right, is everyone all ready to get started?
I'm ready.
Yes.
Okay. So
I'm
Irene,
sorry.
I'm gonna be.
I'm sorry, you guys can go ahead. I'm just having video issues. I should turn on my camera soon, but you can get started.
Okay. Hi, Courtney. I'm Irene. I'm gonna be I'm gonna be your social worker today, and this is the rest of the team. Brian and Sam are gonna be your medical doctors, okay? And then Sarah O is the dental, is gonna be monitoring your dental, and then Sarah A is pharmacy. So just before we start, how's your day been going so far?
So far, my day been going on. Okay, it's okay.
Okay. So I use she, her pronouns. I just want to clarify what pronouns you use.
Uh, my name is Courtney. It's she, her.
Okay. And then what language would you prefer that we talk in today?
Pardon me?
Do you have any language preference? Do you require a translator?
No, just English, plain
No.
English.
Okay. Can you just confirm your name and date of birth?
It's Courtney Grind. Birth is 1960, October 26th.
Okay. And then where are you calling from?
I'm calling from home,
Okay.
remote.
Are you in an area where you feel like you can speak safely?
Oh, yes.
Okay. Okay. So we did go kind of over what you filled out before you came in about some of your areas of concern, and we're going to address those. Okay. Do you feel comfortable with that?
Yes, I do.
Okay. Do you have any concerns that you feel like you want to talk about that you may have not put on the sheet or you think are the most important?
No.
No? Okay. So I'm gonna have um, Brian kind of talk to you about some of your concerns with obesity and that recent weight gain. And I know you put that in your chart that you've been struggling with that. So Brian's going to talk to you about that. Are you comfortable with that?
Yes, I am. Maybe he can
Okay.
help me.
Okay.
I hope I can. Thanks, Irene. Um,
Mhm.
First, I'd just like to remind you that everything we talk about today is private. The technology we're using is encrypted and it complies with all health privacy standards. So nothing that we talk about leaves this room. And you should feel free and safe to share anything you'd like with us. As she said, what I'm going to be talking to you about today is your weight gain over the past 3 years. According to your chart, looks like since COVID hit, we've just had a problem staying active and putting on a little bit too much weight.
That is so true.
Yep, happens to us all. It's a very common problem, especially since the beginning of COVID. It's just harder to stay, accustomed to our normal routines. It's very understandable, but we just wanted to first provide you some counseling for that, and then at the end of the session, we will be providing you a patient care plan for you to take home with you. On that, you'll have more specific recommendations on resources that we offer you, such as like diet plans or exercise routines. So for now, we're just going to talk over that kind of stuff. We should leave you with a more solid, physical form of that to refer back to in like a week from now. Is that okay?
Yeah, sound good.
So I'd just like to reiterate, just kind of talk to you about how important it is that we do tackle that obesity problem today. Weight gain is, like I said, very common and happens to all of us in these times, but it's a major risk factor for a host of other health conditions. And we think it's really important to make realistic steps to that today to make progress, because it plays into so many of your other issues, and such as your diabetes, hypertension, knee pain. All those can be sort of alleviated by starting to tackle the problem of the weight gain. Once we get rolling on that, a lot of those other things will fall in line, and we'll make better steps towards progress on decreasing that blood pressure, keeping our glucose in better ranges. The first thing we wanted to do is just talk to you about your medications. We're going to be going over a couple of the changes to your medications concerning your diabetes and hypertension. I'm not going to touch on those very specifically right now. Dr. Morris and excuse me, Dr. Abdrabo are going to go over those in more detail later. I just wanted to bring it to your awareness that we will be touching on and changing some of your medications so that you're comfortable with that when you hear about it later. And then we'd also like to, again, this will be a resource that you'll have more physically after the visit, but we would like to go over some at-home stretching routines and workout routines that you can do. We saw that, or noted that you had been having some trouble staying motivated for at-home workout routines, and it's harder to get to a gym these days. So we wanted to give you something that was easy and manageable at home, just some stretches to decrease that knee pain and get you more ready for the day. And yeah, with that, a diet is also an extremely important. I'm sorry, did I cut you off? I thought you were going to say something. Oh, sorry. Sorry, I was just going to say, lastly, a diet is an extremely important part of healthy living, and to decrease some of that weight gain. We did see that you've been trying to incorporate more vegetables and fruits into your diet, decrease red meats. Prices today are expensive, and it's harder than ever to stay on top of taking care of ourselves. So another thing we want to do is give you some easy at-home recipes with healthy options. It seems really, it's very scary at first to try to tackle such a big area of our life, but easier, smaller steps, one by one, can make those really big changes. So we just wanted to start with giving you easy, digestible resources and recipes that you can use at home. With that, we know that it is really hard to get your hands on some of those healthier options for eating. There are locations where it's more and less available for us. So I want to direct it back to Irene. She wanted to talk to you about maybe some places you can find or strategies to use to combat troubles getting your hands on healthy, nutritious food for you.
Okay, thank you.
Thank you.
So Courtney, have you ever been on or applied for any food assistant programs?
No.
No. Okay. Do you have a general idea of those food assistant programs, government, either food stamps, EBT?
No.
No. Okay. So I will go over that with you. We'll do like a follow-up. But so that's it. I can't guarantee that you'll meet them. It goes by income, but we can fill out some of those forms. And so depending on income, if you're eligible, you'll have so much allotted money where you might be able to purchase healthier food options if available. Do the grocery stores around you, are there healthier options available?
Yes and no. It's my choice when I go to the grocery store what I pick up because everything's
Okay.
so expensive now. And I'm trying hard to lose weight. So it's expensive with our income.
Hmm. So what grocery store do you normally go to? What's your go-to one?
Kroger's.
I'm sorry, I didn't hear you.
Kroger's.
Kroger? Okay, I just wanted to double check that it was a grocery store like that. Okay, that's perfect. So then, Dr. Morris is going to talk to you about managing your diabetes. Does that sound good with you?
Yes.
Okay.
Hello, Dr. Morris. So a few things I just wanted to touch on. I saw that you check your blood pressure about 4 times a week.
Yes.
That's great to hear. One thing I wanted to touch on is it's a good idea to make sure that you're checking your blood pressure about the same time or same setting every time that you do it. Because I saw that you had some ranges, so range from like 132, 156. So some of those can be just because your blood pressure's high, but if you just like get off a long day of work or have a stressful event happen, your blood pressure can be higher than what it truly is. So, yep. So just making sure that you have a consistent schedule will help make sure that your readings are accurate. Next, I want to touch on, you reported that you missed about 3 or 4 doses last month.
Yeah, I tend to forget sometimes.
Okay. One question is, how do you keep your medication in line? Because I see you have several medications. It can be hard to make sure you're taking them all together on time.
I have them in the cabinet in the kitchen. I just go in and just get each pill bottle. I place them on the countertop and just take one out each bottle and place them back in the cabinet.
Have you heard of those pill organizers where they have like the Monday, Tuesday, Wednesday, Friday, and even can do it by time?
Oh, I need to do that. I have heard of it.
Those can be a great help where you don't even have to think about it. You just grab Tuesday and that's all you have to do.
Okay.
So next, we wanted to talk about an increase in your current hypertension medication of your amlodipine benzapril. So what we were thinking is you are currently on a 5 milligram, 20 milligram current medication. We were thinking of increasing your dose to a 10 milligram amlodipine, 40 milligram benazepril.
So I still be taking one a day.
Correct.
Okay.
And part of the reason we were thinking to do this, one was this would help manage your blood pressure better. And two, we were looking at your labs and we saw that your pretty much your filtration rate of your kidney, that pretty much just lets us know how your kidney is doing. It was within normal ranges, but it was approaching the lower end. So increasing this medication would also put less stress on your kidneys.
Okay.
Do you have any questions for me about what we plan to do with your high blood pressure right now?
I'm understanding now you're going to change my medication. That's going to put less pressure on me by taking a different medication.
So we'll be having you take the same medication, but it'll be a higher dose.
Oh, a higher dose. Oh, okay.
Yep, and that will help your blood pressure and help your kidneys as well.
All right.
All right, great. So next, we're going to have Sarah talk to you about some of your dental.
Okay.
Hi, Courtney. How are you?
Hello?
Hello. Can you hear me?
Yes.
Okay. So I see you've been diagnosed with periodontitis back in March of 2021.
Yes.
So walk me through your dental care routine. What kind of toothpaste are you using? I see you're using Listerine on here.
Okay. I would start first. I haven't been to the dentist since 2021. And the toothpaste, I use Crest. I do floss not every day like I should because of the gum disease. And I use mouthwash and it helps. But
Oh,
see, with the gum disease, it's really hard for me to floss every day.
okay, would you be open to maybe using a water pick if you feel like flossing in between there is just uncomfortable?
Oh,
Because I
I never
see
thought
you
about
have, yeah, it's just like a high pressure water. It'll shoot the water through the contacts, can clean it out if you don't, if you think flossing is uncomfortable, causes you to bleed a lot.
that. Okay. It is, yeah. I probably can catch one on sale at CVS.
Yeah, Amazon, 2-day shipping, quick, easy.
Okay.
So, also see you have some lower left jaw pain.
Yeah.
Yes. What would you rate that? I see it was a 4 out of 10, but you did have a fall recently. Did that pain increase?
Yes, I'll say from 1 to 10, I'll say a 7 now
A 7.
because
Okay.
it's sore on my left side and I'm taking something, but I still have that sore pain.
Okay. Do you notice any swelling in the area or it's just like a sore pain?
It's just sore.
Okay. Do you feel like you're stressed at all? Because a lot of times when we're stressed, we can maybe clench our jaws or grind our teeth in our sleep. It can cause some TMJ pain, which is the joint right up here.
Mhm.
Do you feel like you are stressed and grind your teeth or clench at all?
Not, I would go to sleep. I don't think so.
Okay. So if so, we can definitely recommend a night guard. It's just like a quick little, kind of like a retainer. You just pop it in, really easy. It can alleviate any of the pressure of when your
Okay.
teeth are hitting each other. And I see that your canine, that lower sharp tooth on the bottom, you feel like it's been hurting now due to hot and cold ever since your fall.
Yeah, it's very sensitive to, warm or cold water.
Okay, when you're drinking warm, anything hot or cold, does the pain stay long, or like right when you're done drinking something cold, the pain goes away fast?
It varies.
It varies. Okay. So typically for that, we would recommend a root canal. Is that something you'd be open to as an option for treatment?
Yes.
Okay, yeah, I was just gonna get rid of all the infected tissue in there. We're gonna fill it up so then it'll not cause further complications. And as a toothpaste for you, would you be open to prescribing Prevident? It's just a toothpaste with a higher dosage of fluoride, and that could help you with your any type of cavities or any issues you're having, sensitivity as well.
Oh, change. Okay. I'm
Yeah.
willing to change. Yes.
Yeah, if that's not an issue, if that's something that is not available to you, we can also just pick up some Sensodyne from the CVS, Kroger, wherever. That would help you as well with your sensitivity.
Okay.
Okay, I think now Sarah is going to be talking to you about your medications.
Hi, Courtney. How are you?
Oh, hi, I'm good.
My name is Sarah. I am the student pharmacist here. Sorry, give me one second. I just wanted to talk to you a little bit about your diabetes. I know Brian went over a lot of the resources that we're providing for you, the recipes, the workout routines to hopefully help make your weight loss journey a little bit easier. But after reviewing some of your numbers, it looked we kind of decided that we wanted to change your diabetes medication a little bit. So I just wanted to talk to you about that. So,
Okay.
so what are you taking every morning for your diabetes?
Metformin.
Metformin, okay. And then anything else?
What stick? Let me see. Cicla. Let me see how to pronounce it.
It,
SILPAGTIP.
sitagliptin, yeah, that's a tough one.
Yes.
But yes, okay. So you're taking those every morning. And it kind of seems like it's not really working that well for your diabetes. It looks like your A1C is not at goal like we want it to be, around like we want it under less than 7%, and you're at 7.8%. So what that tells us is your medications aren't working as efficiently as we want them to. So we're thinking about switching you to something that can help with your diabetes, but also help with your weight loss. So it's kind of hitting two birds with one stone. So there's a couple options for you here. I wanted to talk to you about them. If you were interested in something to take every morning on an empty stomach by mouth, there's an option for that, or there's also a weekly injectable. So no, okay.
I would take the pill every morning.
Okay. The reason why I know it's very like scary to inject, especially if you're not used to it, but the reason why I mentioned it is because you do have a few medications you're taking daily, and I know you're missing some of your blood pressure medication, so it might be easier just to do once a week, but that's totally okay. Like Dr. Morris said, the pill pack can really help you. But yes, so taking we're gonna switch to something called semaglutide. It's once every morning. It's a tablet, and you just take it on an empty stomach with 4 ounces of water. And of course, we'll give you, with your discharge papers, we'll have all this information provided for you. So I just wanted to go over that with you. So what questions do you have for me?
None. I think I don't have any.
Okay, so just to let you know, like the first week of this medication, you might feel a little nauseous. And that's we're going to start you at low dose and kind of titrate you up just so we can try to prevent that. But if you do feel a little nauseous, it's totally normal. It's a very common side effect. It should subside as you continuously take it.
Oh, okay.
Yes. So I think we're done. If you have any specific questions for any of us.
Oh, no, we still have one more thing to address.
Oh, I'm sorry.
No, no worries. So you wrote on your file that you've kind of had a loss of interest in just normal day activities or stuff you normally did. How long have you say that's been going on?
I noticed right after COVID, it's just changed. I gained all this extra pound, and I used to work out. I love to read, doing crossword puzzle. Now I don't even like to go do that. I used to go to the library and check books out, but now I'm not interested in that anymore. I just don't feel like I have the energy, and then definitely I need to start getting back into try to be more motivated and exercise.
Mm-hmm. So you think it's a lack of like loss of motivation, not necessarily fear of COVID?
I think so.
Okay, I just wanted to double check on that one. Okay, so have you ever seen a therapist
No.
at all? No? Okay, would that be something you're open to?
If I need one that's going to help me, I don't have no problem going to see one.
Okay, so I'm thinking that maybe we can set you up with one. I can get you in contact with one of my other colleagues, another social worker who can do that for you. Um, and then also you did put on our thing, and I know it can be awkward to talk about sex sometimes. Do you feel like talking about that because you did say you had kind of a loss of sex drive?
Oh yes, since COVID, my husband and we haven't been interested in sex.
Okay. So is that something, okay, so that has me a little concerned too with the loss of interest. Has me a little concerned that you might be at risk for depression. So that's why I want you to maybe see a therapist so they can figure that all out. And then if we find that therapy on its own isn't working as much as it should be, then we can have another conversation with Dr. Abdrado, the pharmacy student, about possible medications for that. But that's later down the line.
Okay.
Okay. And then also, Sarah O talked about dental, and I know you put in your chart that you have a hard time accessing dental care with prices. So I wanted to go over that with you. Is that in your patient follow-up, I'm going to compile a list of dental resources in your area that's going to be more affordable. Does that sound okay?
Yes,
Okay.
it do.
Okay, so that's all. We're gonna go all over that in the patient care plan. It's gonna have all those lists of things. Do you still have any questions about anything else?
No, I just want this free information.
Okay, and then do you think we missed anything? Do you have any other issues think need to be addressed?
No, I'm just so glad I'm getting so much information from you guys, and it's really going to help me.
Okay, we're glad to hear that. So if that's all, we just want to thank you again for meeting with us, and thank you for being so open and honest so we can help you in the best way that we can. So we will follow up with you in the next coming days. I'll send you kind of a packet of all this information, and then I will be kind of your case manager on setting up with possible food assistance programs, and also if there's free fitness programs in your area.
Okay, that will work.
And we'll see, maybe the fitness program, we can set you up with your spouse, maybe to do something together, because I know you wrote on the chart that they kind of struggle too, and maybe it's a good way for you two to connect again, just connect a little bit more.
That makes sense. Yes.
Okay. All right. So I think that's it. I don't know if anybody else on the team has to say anything.
No. Okay. Good working with
Okay.
you guys. Take care.
Mhm. Take
Thank
care.
you,
You have a
Brandy. Take
good rest of
care.
your
you.
week. Okay.
Okay.
Yeah, thanks for your time.
All right.
Yeah, did anyone, so I'm looking at the assignment and some of the concerns and recommendations are already filled out. Is that just like, did anyone do it or is that like?
Oh, that's someone else. Okay. I was pretty confused for a second there.
Yeah, I was like, no one's
We
talking.
were hearing whoever's talking.
All right.
So-
There's someone by me.
Good job.
You're fine. You're fine. Great job. We want to go to the patient care plan. I started writing things, but it keeps getting deleted. I think I can't update the document for some reason.
I can't even access it. So I don't really know. I don't even
Oh.
know.
Okay. I don't know why it's doing that.
I can share my screen if it's even possible. I don't know how to do it on Teams actually. Oh, sure.
So Irene, I actually have a question for you.
Yeah.
So there's like a lot of like treatment care that I would have recommended her, but I know she can't afford it. So that's something you still like give them the option to do, knowing like they can't afford that. Like even just like
Um,
mentioning a root canal, I'm like, she probably can't afford a root canal. You know what I mean?
You can talk about like maybe down the line if that's
Yeah.
something you can see if we can do, but I don't. Yeah, because
Because like to
I
manage
just so
her
sure
like
you just kind of
disease.
try not to like highlight what they can't afford, and we more look up the options we have now, and then like down the line, like give her the option to like, oh, maybe like, do you think you could have like the resources to kind of maybe save up to afford it, and or like
Yeah.
find like a cheap or free resource, like maybe a local college with dental students can do it at a reduced rate, and we'll send Courtney there.
Yeah. Because like ideally she would have to come back like 4 to 6 weeks and 3 months, and I'm like, that's a lot on her. Like I don't even know if I should say that.
Yeah, you can always like mention it just to see, but if they can't, then like just kind of like don't push it on them to like make them feel worse, is like
Right.
how
Right.
you know what I mean?
Brian, did you say you were sharing your screen or?
I tried to, but I can't without. There's like settings that don't let it happen, and I have to close the meeting if I want to do it.
Do you guys want to put it on a Google Doc or is that like not
Yeah,
possible?
we can do a Google Doc.
Because I can just share my
Okay.
Gmail.
Is anyone doing the Google Doc, or you want me to do it? All right, I got it.
Okay, I just sent my Gmail in the chat.
Did you guys send the Google Doc or?
I'm working on it. Sorry, I'm
Oh,
copying the
sorry, no, that's fine.
emails over. Oh, Sarah, could you have Drabo? Could you put your email or Gmail in the chat?
We can always go to Sam.
No.
I just sent it to Sam and the other Sarah. Can you guys open it? Oh wait,
Yeah,
I can just put it in the chat, right? Fuck, I'm sorry. I'm dumb. I don't know what I'm doing. Okay, I put the link in the chat. Can everybody access that?
Yeah, I can open it.
It copied over kind of scuffed. Irene, how did you open it in like in Outlook the first time?
For what?
The patient care plan.
Patient care plan? How do I open it in Outlook?
Yeah.
I made my own.
Did you access it?
Like I'm confused on what you're asking.
Me
What
too.
I was thinking too is that I forgot which one couldn't access it, but whoever can't access it, they could just always write out that in a Google Doc, and like in that Google Doc, and we could just copy and paste it into the one on Outlook.
Yeah.
Okay, I'll
Yeah, the
just do
visited-
that then.
Yeah, because the visit agenda, you just have to do discipline, and like there's a guideline of it on the Canvas page. Like, so I just kind of like made my own from the Canvas. So it says like discipline, concerns, recommendations. And then you'll just have to put discipline, dental, and then your role and responsibility. I can share what it looks like, Sarah, if you need to. Would that be helpful?
Oh, I didn't realize my mic was muted. I was saying, is it just a chart?
Yeah, I put a copy of it in the chat.
Okay, I'll just put that in the Google Doc then.
Okay.
That portion.
That's not letting me share my thing either.
And then you were saying just one person uploads it with all your names on it.
Yeah, because I'll put it all back into like the giant thing. And then I think we each have to send in our own reflection.
Nope, I think the reflection is just one per group too.
Oh, okay.
Do we
Oh, yeah,
have an
never
assignment
mind.
to do on the 26th, I believe?
Yeah, that is all of this.
Oh, okay.
Yeah. Okay.
So it's
Yeah,
a
I was confused
combination
because I
of,
have to send in another.
okay. So we're turning in both of these, like the Google Doc we made earlier and then this chart.
Yeah, and I'm gonna put it all back into like the Word doc, and
Okay.
then I can like send it to you guys to like double check again to go over. And then Yeah. I'll like make sure I have a copy of your Gmail, Sarah, so I can like send it to you that way so you can double check it.
Yeah, thank you.
I'll just make sure I have everyone's so that way. And then on this same thing, we can all write the reflection too on the one.
I started working on it on the bottom of the patient care plan, so someone can copy paste it. I don't think it has to be like super long or anything, but anyone can add whatever they want.
And I think we also each individually have to do like a post survey or something.
Yeah. All right. Sorry.
Get out of here.
Yeah. Okay, I just kind of BS my way through the reflection. It's at the bottom of the patient care plan Google Doc, or I guess I should copy and paste that to the one we're using. If anyone wants to change any of that, feel free. Oh, actually, Irene, where do you want me to put that? Because I guess I should turn them in somewhat separate.
You can just keep it in here and I'll put it back into everything.
Okay, you see it in the Google Doc?
Yeah.
Okay, cool. Well, all right, what do we have left, guys? We get everything? I do see in the patient agenda, dental. So Sarah, on your role of responsibility, if you just want to throw in, you know, one or two of the things you did during the visit in there.
Wait, where do you see that again?
Oh, you're. I'm sorry. I forget.
If you want to throw in the Google Doc, we can throw it into the dental.
Or you can just tell me what would you put for your role of responsibility for that meeting? For example, mine said. Okay, go ahead.
Yeah, just give me your example.
Mine was address weight gain and the health risks it poses, and counsel on effective healthy diet and increased activity. Social work had food insecurity, cost/availability, reestablish care with providers, connect with therapists, find affordable fitness program.
Okay. I'll just type it at the very bottom, like after the reflection.
Okay. Perfect. And then after that, the patient care plan, are we, oh. So I'm just copying things over from the Google Docs, the patient care plan, but I think that's everything, right? Are we all?
Yep.
I think we filled out everything.
I'm still working on mine.
Sarah, I just put in the Google Doc the discipline 5 thing, the other thing you need to fill out for the visit agenda. So you can just fill it out in the Google Doc and I'll put it back in.
Okay. So is this just all her dental concerns and then what I offered her?
This was like in the
Yeah.
pre-visit huddle. We all just came up with like our just random like 3 to 5 concerns. So it doesn't even have to be that like well thought out. Yeah.
And then in the visit agenda, there's like a right below discipline 5, it's like recommendations, but it's like not tied to anything. And I think it's like for diabetes and hypertension. So I don't know if it's for who.
Oh, I think that's mine. I'm sorry. I don't know how it got there. But
Okay.
there it goes.
Is there anything else that I have to add into it?
I don't think so.
All right, that's about everything, right? You got the
I think so.
agenda, patient plan, and reflection good?
Yeah, I finished up my part.
Yeah, I think we're all done. We can probably leave. On the patient care plan, I see like a few boxes left undone, but this has a problem with like updating. So
Where on
I
the
don't know how to
Word
check
doc?
that. on the like Outlook document.
Yeah, because I'll go and add him.
Oh, you're gonna. Oh, fuck. Wow, I just found it. I feel dumb. Okay. Well then, yeah, I think we're done.
Okay. Good job,
Cool.
guys.
It was nice meeting and working with all of you.
Nice meeting
Yep.
you
Yep,
guys.
same
Thank
here.
you guys.
Great job, guys. See ya.
Bye.
All right. Have a
Bye.
good rest of your day.
You too.
You
Bye.
too.